title. Okay, we're good, Madam Chair.
Thank you. So good morning, everybody. We're having our public hearing, which will be followed by a committee meeting regarding federal applications to implement home and community-based services spending implementation plan. Very happy to see you all this morning. I'm wondering if Representative Walker, do you have a few words? I know that Representative France said that he was going to be a little bit late due to a conflict with his work. Representative Walker.
Good morning, everybody. Great to see you all, and I look forward to it. And I also want to add to that list, Senator Winfield. He's minding 2 very sick little children at home, so he will be listening, but only for the voting will he probably join us. Thank you.
And Senator Minor, are you on? I know you were out in Colorado. So Representative Abercrombie.
Thank you, Madam Chair. Good morning, everyone. And I just want to say that I'm so happy that we're finally voting on this 10% increase for our home and community-based providers. It's been a long time coming. I want to thank them for their patience through this whole process. And I have to give a shout out to Representative Cook, Grandma Cook over there with that beautiful, beautiful granddaughter. So good morning, everyone. Thank you.
Senator Moore.
Good morning and Happy New Year. I want to welcome Representative Leeper. Looking forward to it. I want to thank Representative Garibay for sharing some time with us on human services also. Thank you.
Representative Case.
Good morning, Madam Chair. It's good to be here and look forward to our meeting.
And the Senate Chair of Human Services, is that Senator Berthal?
Yes, good morning, Senator, and good to see you as always. Senator Minor is in Colorado. I'm not sure if he's on by phone or whatnot, but I don't think he's going to make, he might make the vote later on. But it's good to see everyone. And I guess enough talking, let's get to work.
I agree. Commissioner Gifford is the first speaker today.
Thank you. Good morning, Senator Austin and Senator Moore and Berthel and Minor, Representative Abercrombie, Walker, Case, and France, and other distinguished members of the Human Services and Appropriations Committee. I am Deidre Gifford, Commissioner of the Department of Social Services. I'm also joined this morning by a number of our team members from DSS, our acting Medicaid Director, Bill Halsey, Don Lambert and Jennifer Cavallaro from our long-term care unit, Joel Norwood, our legal counsel, Deputy Commissioner Mike Gilbert, and Alvin Wilson and David Seifel, our ledge liaisons, and there may be a couple of others that I've forgotten. So this is a complex set of authorities that we're talking about this morning. So we have a large team available to answer any of your questions. Representative Cook, thank you for bringing that little ray of sunshine into our meeting this morning. That's what we all need.
She'll be with us for a whole minute, but it's nap time. So, but she needed to see her first public hearing. So, hey guys.
So as I said, this is a little bit of a different set of authorities that we're talking about this morning. So bear with me. I'm going to walk through the federal framework, and then of course we'll be happy to entertain any and all of your questions. So as you know, under Section 17B8 of the Connecticut General Statutes, we're here today seeking your support for our department's Medicaid, what's called Appendix K, Emergency Preparedness, Home and Community-Based Services Waiver Amendments, and also what's called Medicaid Disaster Relief State Plan Amendments. So in a public health authority, there are emergency federal authorities, these so-called Appendix K and so-called disaster relief SPAs that can be applied for and approved in a quicker time frame. So those are the two types of authorities that we're here today to discuss. Together, these applications will enable the state to provide rate increases to providers and new services to address gaps in our current, and I'm going to use the term HCBS for home and community-based services, in our current HCBS continuum of supports. As we will explain, these improvements are made possible by a new federal funding pathway under Section 9817 of the American Rescue Plan Act. So today we're requesting the committee's approval to submit these federal Medicaid applications to the Center for Medicare and Medicaid Services. Section 9817 of ARPA provides states with a temporary 10% increase in our federal medical assistance percentage, or FMAP, for certain Medicaid HCBS expenditures. The FMAP increase is based on the expenditures that have already occurred from April 1st, 2021 through March 30th of 2022. The ARPA funding is available to enhance, expand, or improve person-centered home and community-based services. This will provide Connecticut with timely access to funds to support both the immediate stabilization of our HCBS workforce and expand needed growth in HCBS capacity, given the paradigm shift in preference for home and community-based services in lieu of institutionalization, which we've all seen highlighted during the COVID public health emergency. So in order to move forward with these SPA and waiver amendments, we needed to have approval of our ARPA 9817 plan. So it's a two-step process as opposed to the usual one-step. So we submitted our ARPA plan to CMS in July of 2021. The plan was developed with stakeholder input, including a public meeting prior to submission. And as you know, a legislative informational briefing was held on Wednesday, August 25th on the plan. Comments of stakeholders were considered in the final CMS submission. The ARPA plan includes a significant focus on provider rate increases and both incorporated and expanded on the legislatively approved increases to ensure a comprehensive approach to provider stability. While DSS submitted the ARPA plan as a single state Medicaid agency, other agencies with certain Medicaid operational responsibilities, such as DDS and DMIS, also have activities that are included in the ARPA plan. So it was a collaborative effort. Please note that the additional Appendix K amendments related to the 3 Medicaid waivers operated by DDS are in the beginning stages of the required notice and comment period under Section 17B8. Based on CMS requirements detailed in our conditional approval letter, those waivers will also need to follow the same public notice, public hearing, and legislative authorization process that we're following today. So we will be seeking your support in that effort as well. So the key elements of our ARPA plan include enhancing the HCBS workforce, support for family caregivers, expanding integration and use of assistive technology, expanding environmental adaptations, enhancing self-direction, expanding and enhancing HCBS delivery transformation to improve quality, and enhancing the provider infrastructure. CMS's approval of the ARPA plan was required prior to the implementation of the plan and expenditure of any ARPA funds. Further, CMS required that any expenditures approved under ARPA also required submission and approval of the underlying Medicaid authorities, such as we're here to discuss today, the Appendix K and disaster SPAs. CMS did conditionally approve Connecticut's ARPA plan on December 23rd of 2021. Conditional approval requires that proper Medicaid authorities are also approved by CMS. So that's the two-step process that I was referring to. Approval of the ARPA underlying plan, and then approval of the Medicaid authorities, SPA and waiver authorities to implement. We did implement rate increases to home health agencies in December of 2021, since CMS had approved both the ARPA plan and the associated SPA. As I previously stated, under the provision of 17B8, we're here today to seek your approval for Appendix K and Disaster Relief SPA 220003. The Appendix K waiver amendments apply to the following waivers. The Connecticut Home Care Program for Elders, personal care assistance, acquired brain injury, HCBS support for persons with autism, acquired brain injury 2, mental health, and Katie Beckett. The Appendix K amendments are temporary and expire 6 months after the federal COVID-19 public health emergency ends, so we will need to seek permanent authority for these changes after the Appendix K approvals expire. SPA 220003 applies to Section 1915I and the applicable services in our Community First Choice program. That SPA is, as I mentioned, a COVID-19 disaster relief SPA, which is also temporary and expires on the last day of the federal public health emergency. So we'll also need permanent SPA to maintain these changes as well. So the applications under consideration today enable implementation of the following improvements. First of all, rate increases. A 3.5% rate increase for all services, for all service rates other than the following provider types.
The proposed legislative agenda.
So let me just say that again. The 3.5 rate increase for all service rates other than the following provider types: assistive technology, environmental accessibility mods, personal response systems, skilled chore, specialized medical equipment, individual goods and services, and all self-directed services. A 1% performance-based rate increase for all services other than those I just listed, and a 6% increase for agency-based personal care assistance, chore and homemaker companion services, assisted living services, adult day health, recovery assistant, community mentor, and agency-based respite services, and the providers related to the cost of complying with the state's increase in the minimum wage. In addition, there is a stabilization payment, a one-time lump sum stabilization payment calculated as 5% of state fiscal year 21 expenditures as applicable. And in addition, there are service expansions, the addition of care of persons with dementia in their environments, COPE. That's a program that provides enhancements for caregivers around those with dementia, and Dawn can provide additional information. Care for the Caregiver program, community aging in place, advancing better living for elders, and applying those additional services to applicable benefits. The notice of intent for the Appendix K and SPA were posted for public review and comment in the Connecticut Law Journal on November 30th. Additionally, they were both posted on the Department of Social Services website. The Appendix K was posted at DMIS website, and all were posted for a period of 30 days. The SPA received 1 comment, and the Appendix K received 45 comments. DSS respectfully requests that the committee authorize DSS to submit the Appendix K waiver amendment and SPA to CMS. I welcome your comments and questions, and I have the team available to do so. Thank you, Senator.
Thank you very much, Commissioner. We're going to go to the 2 public speakers first and then do comments or questions. So if you wouldn't mind just hanging around for a little bit, Commissioner, that would be great. Tracy Wodach, are you here today?
Yes, I am, Senator
Okay,
Austin.
Tracy, you're up.
Thank you. Good morning, Senator Austin, Representative Walker, Senator Moore, Representative Abercrombie, and members of both the Appropriations and the Human Services Committee. My name is Tracy Wodach. I'm the president and CEO of the Connecticut Association for Healthcare at Home. Our association supports the licensed home health and hospice agencies, as well as some of the larger Medicaid participating homemaker companion agencies. The association and its members strongly support both Appendix K as outlined by Commissioner Gifford and the changes to SPA 210032, all outlined in the Connecticut Law Journal posting from November 30th. The association and its members thank the Appropriations and the Human Services Committees, the Department of Social Services, and the Office of Policy and Management for these proposed changes. But more importantly, the changes outlined in the entire state of Connecticut spending plan for implementation of the Arpa of 2021 Section 9817. These proposed changes are a needed investment to enhance, expand, and strengthen Medicaid home and community-based services and could not come at a more crucial time, a time when COVID continues to create chaotic and crisis-level challenges. The unpredictable economy is producing rising inflation, abysmally low provider reimbursement rates, added COVID costs, and a drastically dwindling workforce that cannot keep up with the growing needs of the community, never mind the most current COVID surge. We agree that this plan is a solid start to the intentions outlined to enhance, expand, and strengthen home and community-based services. However, the proposal was released in August 2021. It is now January 13th, 2022. Home and community-based providers are giving up as they needed this money long before now. We urge you to approve these SPA and waiver amendments outlined today, and for DSS, giving DSS and OPM the ability to immediately implement the plan. We also urge DSS and OPM, as well as the legislators, to continue to invest in home and community-based services and the providers of this care. This cannot be a one and done proposal, or the intent of the plan will not be met, which in turn will drive Medicaid costs up higher, including care such as ED visits, hospitalizations, nursing home placements, et cetera. I do want to call out a couple of specific areas of the plan that are posted, specifically the increased rates totaling up to 10.5%, as well as the 5% one-time incentive payment. In addition, we applaud DSS for looking to implement some proven research-based support services. Commissioner Gifford mentioned COPE and Capable, which are ways to keep people with disabilities and dementia in the community. Our home health care agencies are looking forward to partnering with DSS on these new programs. I do want to call out one area, it's not in this amendment today, but the issue of continuous skilled nursing in the full ARPA plan is stated for pediatric complex care only and does not include adult complex care. These are patients living in the community that have high-level intense needs, 16 to 23 hours per day, suctioning, breathing, trachs, vents. When they turn 19, their care remains the same, but unfortunately, the plan only is addressing pediatric complex care. So please, in your negotiations and discussions moving forward, we urge DSS and OPM and the legislators to address this discrepancy as soon as possible. In summary, the Connecticut Association for Healthcare at Home and its many members who offer Medicaid home and community-based services applaud and thank DSS, OPM, and the legislators for these proposed rate increases, expanded programs, and initiatives to enhance the much-needed workforce. We support the changes outlined in the SPA posting as well as the full proposal, with the exception of the pediatric complex care issue that I outlined above. Thank you so much, and please let me know if you have any questions. I'd be happy to assist.
Thank you very much, Tracy, and thank you for the work that you do. Marlene Ciccarella, are you on?
Good morning. Yes, I am.
Okay, the floor is yours, ma'am.
Thank you so much. So at first I want to say good morning to all the attendees and of course the members of the Appropriations and the Human Service Committees. My name is Marlene Ciccarella. I am chair of the HCAOA Connecticut DSS Medicaid Committee and managing partner for B&M Homemaking and Companion Services. I own an agency that's a bilingual office located in West Haven. We are a non-medical home care agency providing homemaking, companion, and PCA services, and we have been in business since 2004. Our primary clients come to us through referrals from the Agency on Aging and Department of Social Services. So I'm here today representing HCOA Connecticut and the submitted testimony. And I want to thank you all for all of your very hard work and support and the opportunity to speak this morning. So thank you. So first, I want to talk to you about what it means to us for this one-time temporary increase in provider payment rates proposed, what that means to us and our clients, the staff, and that provide these needed services. So first, it's going to give our staff a fair hourly rate based on performance, years of services, training, and certifications. This would allow us to retain staff and improve our ability to provide services to our clients and reduce the wait time for staffing assignments or changes. This would also allow my agency to increase support roles, such as client staff coordinators, where positions were reduced over the past 2 years. So clients will be assured that they will be able to continue with needed services that they qualify for based on medical concerns, physical abilities, financial situation, and lack of available support, either by family or state-funded programs. So now I want to talk to you about what the impact would be if we are not approved, sustained, or a plan is put in place to address the continued increase in minimum wage, along with an increase in expenses. So today, many agencies have stopped taking new clients, and some are stopping select services. The decision to do this was not an easy one, acknowledging the impact to our clients and our staff. Some agencies may even be forced to close their doors. The state will quickly find themselves paying much more and for the wrong service. Medicaid will be forced to fund unnecessary and expensive institutional care instead of appropriate, desirable, and low-cost home care. This temporary rate increase only provides temporary relief, and the impact noted will continue to be an issue for agencies and the state going forward. Agencies will be paying out more in expenses with the next minimum wage increase in August than they are allowed to bill. The people most impacted are the ones that are the most vulnerable. I can give example after example of clients and their specific needs that I talk to on a weekly basis, sometimes on a daily basis. The benefit of agencies like mine allows the state to save taxpayers $450 million per year and keeps individuals in their homes longer. That's a win-win situation. Each agency model is different. My agency primarily works with Medicaid clients referred to us through the Agency on Aging and DSS. My partner Blanca Gonzalez and I have been in business for almost 18 years and managed the dramatic and extraordinary changes and expenses due to the pandemic over the past 2 years. But the next increase in minimum wage will place us in a very difficult position that is not within our control. We're dependent on the rate increases. We support 150 clients and employ 160 home care staff. I've had to start thinking about what to tell our clients and staff if the decision is not made timely and there's no plan in place for the future. I and other agencies strongly support the minimum wage and increase, and we're only looking for a fair billing rate that will be sustained. We support this and want to partner with the state to ensure the needs of our clients are being met to the best of our ability and taxpayer dollars are spent wisely. So thank you, and I'm happy to answer any questions you may have.
Thank you for that. We really appreciate it and appreciate the work that you do, Marlene. So everybody knows the drill. If you have any questions, please put your hand up. I do have one question, or actually 2 questions, Commissioner. What is the process to put these into these rates into a permanent rate versus the temporary rate? And when can we start that?
Senator, just to clarify, are you talking about the permanent authorities that aren't related to the disaster spa and Appendix K that I referenced in my testimony?
I'm referencing the increase in the rates of pay so that we can make sure that after the federal disaster, we can have permanent rates, that we don't go back to the rates that are not sufficient enough to support the jobs that are in these particular arenas.
So Mike, I'm going to defer to DC Gilbert to address your question, Senator.
Thank you.
Thank you, Commissioner, Deputy Commissioner Mike Gilbert. Senator, the rate increases, with the exception of one rate increase, are ongoing. So they will continue, and they are projected as such. They've been incorporated into the estimates that we've been working with in cooperation with OPM. The one rate increase that is temporary in nature is a 5% supplemental one-time stabilization payment that is being made this year. The 3.5% increase, the 1% value-based payment increase will continue as mentioned. In terms of authorities, we will need to come back to you to request permanent waiver authority, once the Appendix K disaster authority is ending. So that will be sort of our authority pathway, but the funding piece has been incorporated into estimates and will be in the SFY 2023 updates that will be provided to you in February.
Thank you very much for that. I see that Representative Case has his hand up. Representative?
Madam Chair, I'd like to go to my good chair of Human Services first as a courtesy, if I can.
You may. Representative Abercrombie.
Wow, thank you, Representative Case. You probably want me to ask your question first, that's why. Good morning, everyone. Thank you, Commissioner, and your team for being here. Just a couple of quick questions to follow up on Senator Austin. So because you have to ask, we have to put it in the budget in 23 to make sure that funding is still there. Do you have to go through another SPA application because it was temporary and now you're going to make it permanent?
We will need to do a permanent waiver amendments and permanent state plan amendment authority. I don't anticipate that as a barrier. Those are, as you know, routine processes. The reason why we proceeded with the Appendix K and disaster SPAs is because at the federal level, the approval process there is expedited. So we will be able to get approval for these changes in fairly short order. That's been our experience throughout the public health emergency, submitting these types of federal authorities. They were turned around very quickly by our federal partners. The permanent authorities can be a little bit more time consuming. But as you know, we have lots and lots of experience on waiver amendments and SPAs. So we will, as soon as these are approved, we will be sure to have those permanent authorities in place in the appropriate timeframes.
So just to follow up on that, my understanding is that currently the public health emergency from the feds is in effect for the first quarter of this year. My understanding is that the feds are going to come out within the next week or so and extend that. And the hope is it's going to be for the whole year, which will be great because in Medicaid, we will continue to get an enhanced match, which is going to be awesome. The question is, if the public health emergency is extended till the end of the year, and I'm not sure if you responded to this, how soon before the end of the year can you apply for the SPA to make it permanent? Or do we have to wait till the budget starts in January of 2023 to be able to apply?
Joel, is Joel on? I think that's a Joel question. Joel Norwood, one of our department attorneys who deals with our federal partners on authority issues. Is he on? Do we know?
Yes, I'm here, Commissioner. Thank you.
You want to take that question, Joel?
Sure. So we've had to do this in a couple of instances where we've had a disaster relief SPA, and then we intend to add it permanently to the Medicaid state plan. So you raise a good point, Representative. I think when we submit these, we can raise that question to CMS just to make sure that it lines up, but that shouldn't be an issue. We can certainly submit anyway. And if they say, well, no, you can't use this authority until the public health emergency ends, that's okay, because we'll just have dual authority to get federal matching funds for the same programmatic changes. So if the public health emergency is extended, that won't stop us from also seeking the permanent authority.
So is the process for the DDS waiver amendments that I think you spoke in your testimony that are going to be coming forward, is that going to be the same process for them also? Are they going to be temporary under the state of the, under the public health emergency? And then we're going to have to go through that process again in 2023?
Yes.
Wow. Okay. So maybe there's some conversations we can have that maybe legislatively, as long as we're in an emergency, we can expedite this process, because with all due respect, and I'm not saying that it was you, but this was supposed to be an expedited process. Yet here we are in January of 2022, when this money was brought to the state in April of 2021, and it took all this time to get it done. And I'm not saying it was on your end. I'm just saying the process is what it is. And if it took that long and an expedited process, I'm very concerned what'll happen once we have to start to reapply. So maybe we can talk offline about if there's an opportunity legislatively to make the process simpler, as long as we're in a public health emergency. So thank you, Madam
Representative,
Chair.
I very much appreciate you bringing that point up, Representative. I think we agree and would very much appreciate engaging with OPM and the legislature in a dialogue around these emergency authorities. In addition to this process we're engaged in now, which added some time to the approval process, we also had this ARPA plan. So when we had Appendix K and disaster spas that were not related to this overlying ARPA 9817, we were able to get those done in very short order. But because we had this umbrella ARPA plan, which is providing the funding, substantially providing the funding for many of these changes, we needed the conditional approval for that process first. Then when we got that conditional approval, they said, you also need the underlying Medicaid waiver state plan and waiver authorities. So we've had that multi-step process, which we agree has prolonged the process a bit due to these administrative processes. So we would appreciate the conversation you referenced, Representative. Thank you.
Thank you. Thank you, Madam Chair.
Thank you very much. Representative Case.
Thank you, Madam Chair, and I thank the chairwoman for asking her questions. No, those weren't any of mine, sorry. So going forward, and we look at this and we see some of this funding, I guess my concerns is, and being on this meeting, is how is this going to be sustainable? How are we going to make this work for these agencies, these community-based agencies? I understand that there's dollars out there and we're increasing them on a temporary basis because of what we're going through right now with the pandemic. And I do agree with what my good chair said. You know, this money was here long ago, and here we are today approving some of those dollars. But we need to give sustainability. I believe there's going to be more people taking advantage of these at-home programs and these outside agencies, because that's the way things are going. People want to stay home. Are we ready to fund that? Are we ready to make that commitment? And are we ready to give sustainability to these agencies so they don't have to look at it as a temporary fund? And on the appropriation side, which hopefully next time I will be on appropriations, we can find the dollars and make sure that our people are taken care of in these home agencies. They need sustainability. I don't think that this plan gives sustainability. I will support it because it's temporary basis, but we're going to hit a cliff. And when that cliff hits, we better be ready. And does the commissioner have anything? Does any of the agencies that testified have anything that they want to add? I'm scared of this word temporary. I want sustainability for what we're doing. That make any sense? I see Representative Walker shaking her head, and I love when she shakes her head because that means money.
So again,
if I could interrupt too, Commissioner, I appreciate your Representative Case's comments, but I do believe that this has been for the first time in decades, we have been able to support many of the things that had taken severe hits. And now people are recognizing that the services that are being provided that everybody said was going to save us money still need to be supported. And that would mean that the workers in those services have to make enough to have a living wage, and we have to recognize that. And I think that that's something that we have recognized. And how are we going to find the dollars? We're going to find the dollars because the only way that this system is sustainable is to find those dollars.
Anyone else want to jump in on that, on the state?
That's where
Senator Austin, and I appreciate you coming forward and saying that. But can somebody explain to me also the 3.5% increase and the 6% increase for two different categories? Why aren't we equal across the board?
Commissioner?
Right, Mike, I'm going to defer the fiscal questions to Mike because he's the subject matter expert.
And Commissioner,
Mike,
I thank you for everything you're doing. It's nothing. These are just questions that come out of a meeting.
You're welcome, Representative Case, and you're always very gracious, and it's very appreciated. DC Gilbert, could you address both the temporary nature of what, again, reemphasize that these will be permanent Medicaid authorities, and then the two different rates that the representative referred to? Thank you.
Sure, thank you, Commissioner. Representative, those are two, right, they're two separate and distinct, well, actually there are more than that, but the pieces that you referred to, right, they're the 3.5% is a general across the board rate increase, which will be continued, right? While this is a sort of a temporary waiver authority, from a budget perspective, these increases are being built in so that they continue to go forward, right? So that they are permanent. And we will seek the permanent waiver authority to match the funding path that we're on. The 6% increase is a separate increase to address the minimum wage increase that occurred on August 1st of this fiscal year, August 1st, 2021. So that will also be a permanent increase. It will be funded in the budget on an ongoing basis. So both of those will be permanent. The 1% value-based payment add-on that providers can earn for meeting certain conditions is also a permanent increase and will be funded as such in the upcoming technical adjustments to the budget. So those three items will be permanent. They are separate and distinct rate increases. So, in aggregate, it is possible that for some services, there will be up to a 10.5% rate increase. I would add that in addition to that, right, there will be ongoing increases built into the budget to recognize the continued increases in the minimum wage. So, we are working with OPM to include the next minimum wage increase, and there will be, while that was already included in the base biennial budget, that will also be permanent. So these rate increases are intended to be permanent. There is only one, as I mentioned, that is temporary in nature, and it's a one-time lump sum distribution of 5% based upon SFY 2021 expenditures. That is the only piece that will be temporary, and that will be additive in addition to the 3.5, the 6%, and the 1%. That is a separate increase.
So if you don't mind, Michael, if I can do this in layman's terms, who does the 3.5% increase go to?
It goes to all providers of waiver services. So each waiver service, with a few exceptions, right, for services that are more, I would say, purchase oriented, right, purchasing equipment or things of that nature. All services will receive that 3.5% increase. So it will go to the 6%. The 6% will go to waiver services that are generally provided through lower wage providers. So it doesn't go to each and every service, but it does go to services like companions and homemakers, personal care assistants, recovery assistants, many of the services that generally are provided through lower wage employees.
I just think that, we have the minimum wage, and I know Kathy and I have been talking about this in length over the years, and sustainability, and I don't know why we're picking winners and losers and giving some 3.5 and some 6%. That is something I have a problem with. There should not be a differentiator of a percentage of who gets what and how much they're getting. We all know that the minimum wage was coming. We all worked on that. There should be no difference in what somebody is getting because we are all servicing the same people. And I believe we're going to have a bigger clip because there's going to be more people that are taking on these services. With that, I'll leave it up to other questions. I know Representative Walker shaking her head, so I like that.
Thank you, Representative Case. Representative Walker.
Thank
followed
you.
by
Thank you,
Senator
Madam.
Moore.
Thank you, Madam Chair. And Representative Case, I look forward to having you back on appropriations. I kind of want to continue with this. It's funny that Representative Case and I are kind of going in the same direction, so allies come together. I agree with Representative Case. It's sort of sad that we're picking and choosing. And so with that, I ask, how many people, how many agencies will be affected by these increases? And what is the actual bottom line dollar amount that the state will have to pay for these services?
Dawn, do you want to take the first part of that, or Jennifer, the first part of that question?
No?
One?
Tracy, you want to tell me?
Oh, sorry, I was on mute.
Sure.
So the
Okay.
first question was how many agencies?
Mhm.
I can get that answer in about 2 minutes, and I'll look it up. I can get the actual answer. I'll defer to the second question while I do a quick peek at that.
Go ahead, Mike, on the total amount. You have it?
Sure. The total amount that's going, the estimated total amount that will be for the waiver services that are included in these submissions is in the range of $70 to $75 million of new funding for the items that we talked about, the 6% minimum wage, the 3.5% across the board increase, 1% value-based payment rate add-on, and the 5% stabilization payment. That is in the range of 70 to 75 million. There are additional funds that are also going to the home health agencies, which are obviously separate and apart from these authorities. And that 70 to 75 does not include the home health investment, which is
Okay.
significant also.
So how much will the home health be? How much is that costing? And to back up that question also, are any of these available for enhanced match? And what is the state cost versus the total cost? That's what I really want to know.
So Representative Walker, just to clarify, and I'll defer again to Mike, but these, the reason why this is under the framework of the ARPA plan is that these are, and why we needed to wait till the conditional approval of the ARPA plan is that these, in large part, these changes are being funded through 2024 with the ARPA enhanced match. And that process will bring close to $500 million to the state across all of our agencies and all of our HCBS in new funding for HCBS services. So I don't know if you're asking for after the ARPA plan expires, or but this is being funded under enhanced match to respond to your question. Mike,
Okay.
did I say anything incorrect there?
No, I that was correct, Commissioner.
Okay.
In regard to the specific home health question, I don't have the exact number, but approximately 25 million in additional spending will be going to the home health area to cover, the 3.5% increase that they received, the 1% value-based add-on, a minimum wage adjustment for homemaker services, and also the pediatric complex care increase of 31.7%.
Okay, thank you. Thank you, Commissioner. Thank you, Mike. I was looking for both. I understand this is under ARPA, it's still state money that came to the state, so we're still paying for it. So that, I mean, the part that comes out of our pocket, which the match, the total amount for the waiver is approximately 70 to 75 million, plus the home health aides was another 20 million, correct? 25 million. So it's about 100 million in total from the state. But the overall amount that we will gain in this is a total of 500 million. Is that what I'm hearing?
Representative Walker, I just want to make sure people are understanding, because I want to make sure that everybody understands on the ARPA. It's not the ARPA dollars that the state has aside. This is different ARPA dollars that the state hasn't actually gotten yet, is federal dollars. I just want to make sure that people are not confusing the that appropriations. Appropriations still has some 218 million to appropriate. So I didn't mean to interrupt, but I don't want people to be confused by the ARPA designation. Thank you.
Sorry, I did mix it. I apologize. Sorry, Mike, you were finishing your statement.
I was just going to address the question. There is, right, the ARPA investment of 500 million is across a 3-year period. But yes, 100 million approximately in DSS rate increases. Obviously there are other, the DDS piece will be coming before you, which is also, part of that reinvestment, 500 million that the commissioner referred to. And there will be some other activities that will be rolling out in SFI 2023. So, in addition to the rate increases, there are other areas in the ARPA plan that will roll out.
Okay, all right. And Dawn, do you have my number?
I do. So there are about just over 100 different types of services that are impacted by the 6%. And the reason, and they're just over 400 specific agencies. The reason it's so high relative to the number is because we're talking about the direct workforce. That's the majority of the workers that are out there whose pay is more based on minimum wage than some of the other supports that might have a different level of specialization as a worker. So it's the majority of the workers, because it is our direct workforce that is part of what's getting the 6%, majority of what we're doing.
Okay, thank you, Dawn. And Commissioner, when does this take effect? Is this backdated to August 25th, or does it go all the way back to what was the other date? 7/20.
The rate increases will be retroactive till what date? Can you remind me, team?
August 25th?
7/1 for the 3.5%. The 3.5% will be retroactive to 7/1, and the minimum wage increase was effective 8/1, so that will be retroactive to August 1st.
Thank you. Thank you, Madam Chair.
Thank you. Senator Moore, followed by Senator Berthold.
Thank you. One of my questions was just asked about being retroactive back to the original date. I had a question about the 5% one-time stabilization. Is that across all providers, and are there restrictions on how that 5% could be used?
Yes, it is across all providers, and I do not believe that we have issued a letter around restrictions, but the team should correct me if I'm wrong.
That's correct, Commissioner.
Yeah, thank you.
Although the intent is specific in the language, which is recruitment and retention.
I'm sorry, equipment and?
No, sorry, recruitment and retention, but we have not yet issued a letter, as Commissioner Gifford mentioned, for guidance.
It doesn't go toward pay, salaries.
We have not actually issued formal guidance around restrictions or permissibility, except right now, all we've stated is the intent of the money, which is to improve recruitment and to improve retention.
And is that 5% retroactive also?
Senator, it's a one-time lump sum payment, so it's to cover losses that were incurred over a retrospective period. Because what we heard from industry partners was, the pandemic has caused a lot of financial disruption, et cetera. And so, like we have done for many other industries over the course of the pandemic, it's meant as a type of relief payment to address some of the challenges that the industry has faced in financial viability over the course of the pandemic. So it's not attached to specific dates of service, but it's meant to address challenges that occurred in the past.
Thank you. Thank
Sure.
you, Madam Chair.
Unmuted. Thank you, Senator Moore. Senator Berthel, followed by Representative Hughes.
Thank you, Senator Austin. First of all, Commissioner Gifford, Deputy Commissioner Gilbert, thank you for your hard work here and for providing us with on-the-go information in addition to a well-thought-out strategy. I would actually align my thoughts this morning with those that have already been made by Representative Case and Walker. I think that we're doing the right thing here. Tracy, thank you as well for your impassioned presentation as well regarding the support that you offer through your agency to the people who are out helping people who really need us to help them. I remain very concerned with, despite a lot of money that is coming in, I remain concerned when we fix things for today. And maybe in this case, Commissioner Gilbert, you mentioned $500 million that'll be spread over agencies over 3 years. It's a lot of money, but it's also a lot of money that we're looking to spend. And I think that we need to remain cognizant, aware, and deliberate with respect to how we're going to address what will inevitably be another potential funding cliff in the state of Connecticut. And we know that we have these, we know we create them. We all are passionate about the various things that we're passionate about and what we make important within our own legislative priorities. But I'm very concerned when we look at the out years, as we call them in the budget, that we are going to be up against large dollar increases that we're going to have to try to fund. And I think we could all agree that we're in a, despite all this ARPA money that has come in, despite all of what we think right now might be some more stable financial times, that all dries up at some point. So sustainability is something that we should be keeping in the forefront of our thoughts when it comes to, I think, and Representative Walker, I think you clarified this, we're talking about $100 million right now in additional spending for the state, even when we apply all of the ARPA money at the moment. So that's what I want to be on record with. Again, I'm not looking to in any way discourage what we're doing here, but I'm a fiscal conservative, and I remain very concerned about sustainability and a large cliff that is coming at us in the next 2-3 years when all of this funding dries up. So thank you, Madam Chair. That's all I wanted to say this morning.
Senator, may I respond, Senator Austin?
Yes, go ahead, Commissioner.
Senator Berthel, thank you for those comments, and we of course agree, and we believe it's important to look at the Medicaid program as a whole when you're talking about sustainability and spending. As I think Tracy alluded to, the goal of home and community-based services in most cases, and the goal of all of the work that we've been doing on so-called rebalancing, is to keep people in their homes as an alternative to institutional care, which is more expensive. Mm-hmm. And for the vast majority of the individuals that we are serving in these waivers, they meet an institutional level of care. That's a qualifier for them to receive waiver services. So, but for these services that they receive in the home, they would qualify for a higher level of institutional service, which is more expensive. So our goal here is, if done right, and Connecticut should be proud of all the investments in both human and financial resources that we've made in our home and community-based system. if done right, it's a win-win because the families, the caregivers, and the individuals receiving the services are happier because they are able to remain in the home, and it can save money. We're in the process of working with our long-term care industry who are working through this process of rebalancing and how do we right-size the long-term care industry coming out of COVID. HCBS is a key part of that continuum. So we totally relate to and understand what you're saying. And I think if you look at the care of individuals with disabilities and other home care needs as a total, we see this as a cost-saving endeavor as well as being the right thing for people who need it.
Thank you, Commissioner. I appreciate the additional clarity there. Thank you very much.
Thank you, Senator Berthal. Representative Hughes, followed by Representative McCarty.
Thank you, Commissioner. I also want to reframe that we are making a historic investment in that direct care workforce because of the pandemic. We've recognized the impact and loss if we don't do that now. And one of the things so we're working with our federal partners who also recognize that without these direct care frontline workforce investment in the care economy, it's going to cost us way more in the long run, like you said, with institutional care, which it did originally. But the one-time stabilization, I'm questioning Tracy when we talked back in the complex care committee about some of these home care agencies going under. Will they still get that, or is it just the ones that have held on until we can get this money to, backfill the costs that they've incurred? I'm just curious as to, and that goes for our retro pay to frontline workers, to increase the minimum wage and so forth. We've lost some of our workforce and providers, and I just wonder if this is rescuing them.
So Representative Hughes, and I appreciate that Tracy had a conversation with you, but what agencies are going to be paid would be better answered by Commissioner Gifford.
Perfect.
Because I don't think that Tracy knows all. I know she knows a lot. I don't think she knows all the agencies out there. So if you, all due respect, if you don't mind, I'd rather have Commissioner Gifford answer that question. Commissioner.
So I think Dawn is probably better qualified to respond. Excuse me for deferring, but I'm happy to be supported by my very competent team here. Go ahead, Dawn.
Thank you, Commissioner, and I'll be backed up by DC Gilbert, since we do a lot of teamwork here. But the way that we crafted the Appendix K, if you take a look at the details in there, the 5% is based on providers who actually are still with us. So they have to have active claims. We did not go back and offer the 5% to providers who, for whatever reason, decided to no longer be a Medicaid provider. You had to be an active provider. And if you're an active provider, we will go ahead and look at your claims from state fiscal year 21 and make sure that you have money to continue to retain that important staff who helped us all the way through the pandemic in the beginning and continue to do that today.
Great. And again, I want to applaud Connecticut and the whole team for really recognizing the historic investment that we have to make in this home care based services, because it is the future, as and my colleagues have said.
Thank you, Representative Hughes. And Representative Abercrombie, you have your hand up, and I'm going to get the other two people that are up for the first time, if you don't mind. Thank you. Representative McCarty, followed by Representative Aurora.
Yes, thank you very much, Madam Chair, and I'd like to thank the commissioners for the presentation today. Very important. I'm fully supportive of these waivers. I think it's time that we really look at our home community-based services and recognize the tremendous worth that they have. For years, we've been talking about an increase in Medicaid reimbursement. I'm glad to see today that we're making a step in the right direction, but we do need to continue as we put a lot of the mandates forward. So it's incumbent upon us to really provide the necessary resources to our home and community-based services. This is a step in the right direction, but I'd like to align my comments with those that have been said that we need to be able to sustain these investments going forward. And I'm committed to doing that. I know it's a little bit out of the scope of today's hearing, but I think it's related to it in some way. We heard from the home community-based services about the complex pediatric needs that are going on, and we recognize that, but the adult complex needs and the overall ARPA plans were omitted. If there's a way that we could find out what type of funding or resource, what the dollar amount is for those services going forward, I would certainly appreciate it, because we cannot have a gap in providing services to our adults that age out. So they're going to also need those dollars. So if we could get some sense of what we're talking about in funding for those particular area, I would certainly appreciate it. But again, committed to really helping our home and community-based services. We learned $450 million they're saving the state. We put mandates on, we need to find those resources to keep those agencies and providers viable long-term, not just today, but this is a very good step in the right direction. Thank you for allowing me to comment. Usually I just try to make my question and end it, but I appreciate that latitude today. Thank you.
Thank you, Representative McCarty. Commissioner, do you have any idea what the adult complex care would be in cost?
I don't. We will get back to the committee with that answer.
Thank you very much. Representative Aurora.
Thank you, Madam Chair, and thank you, Commissioner Gifford, for the presentation, and everyone at the agency. It's very clear that that our home-based services are extremely important to our communities and to our to so many in our community, and I really appreciate some of these suggestions being made. I just wanted some clarification here. And number one, am I reading this right, that of the 500 million, 80 million over 3 years is for the rate increases, which we were discussing in terms of 3.5% and 6%. So basically 26 million, or I'm just dividing 80 by 3. So 26 million a year is what we're really talking in terms of rate increases, and everything is other programs.
Commissioner?
Yeah, Mike, could you take that, please?
Sure. Representative, those were annual figures that I was giving you around the 70 to 75 million related to waiver services. So that was not over the 3-year period.
Because I'm just looking at the presentation and it says enhance HCBS workforce 189 million. And of which provider rate increases is 80.7 million. And, I'm just adding up the numbers. That 189 is part of the 500 million, which is the total over 3 years. Does that sound right? These are big numbers, but I think it's very important for us to, sometimes we spend, quite some hours over $5 million. And I think this one is a $500 million discussion. So I really want to get all these numbers in my head really right. This is why, taxpayer really wants us to do as your legislators, as their legislators. So if we're talking about 500 million over 3 years, the way I read it, and perhaps I'm not reading this presentation, which is very well put together correctly, that 189 million of the 500 over 3 years goes to enhancing HCBS workforce. Of that 189 million, 80 million is basically for what we are talking about, the 3.5, 6, and 95 million is for temporary workforce and provider stabilization. So it appears to me that the 80 million is I like that investment, and I'm assuming if it's 26 million a year going forward, I think it also seems very manageable after the cliff, in a future basis. I just want to confirm, because if it is per year, then we're talking about 540 million over the 3 years, which one makes sense because the overall number is 500 million.
Commissioner or DC Gilbert?
Representative Aurora, can I just clarify the presentation that you're looking at? Was that our presentation on the overall ARPA plan from August? Because those figures don't appear in our testimony this morning. So I just want to make sure we're looking at the same documentation.
Yes, indeed. The presentation is a 27-page PowerPoint from August 25th, 2021.
Okay. All right.
But they do add up together, or they are different. They don't apply. Is it an old presentation I should not look at?
No, it's definitely relevant. I would say that it's a tiny bit confusing, I will acknowledge. What we are under consideration today is a subset of the very large overall categories for the entire ARPA plan that you're looking at. And we're referencing a subset today that has to do with certain of those rate increases. So I'm not sure there's a one-to-one match between the categories you're looking at and what we're talking about this morning. But we would certainly be happy to engage in a follow-up conversation if it would be helpful to talk about how what we're doing today relates specifically to those underlying categories. That those are comprehensive. It's also a little bit, there were some different ways of arriving through the legislative process and the ARPA process at the rate increases we're talking about today. So it's not exactly an apples to apples comparison. And I don't mean to be putting up smoke and mirrors here. We're completely happy to walk you through it. I'm just not sure the two presentations are exactly comparable.
Thank you for that. Thank you for that clarification. Actually, I will be voting, so I want some clarity. That's why my questions. I'll try to kind of focus on what I would like to know. How much are these rate increases going to cost the state per year? That is a relevant question to our discussion.
But I believe that Representative Aurora, that answer was clarified with Representative Walker. Are you looking at those numbers? And it's not the ARPA dollars are not state dollars, they're federal dollars. So the first couple of years would be federal dollars, not state dollars. This year, it would cost the state no dollars. And so I just want to make sure that we're not conflating our concerns on this temporary SPA with the out-year sustainability, although I think that looking at the OFA reports would give you some of the answers that you're looking for relative to the out years.
Madam Chair, if I may ask the question, I understand that part of it we're gonna pay from state funds, part of it we're gonna pay from federal funds, and all of that is taxpayer money. And I know our jurisdiction is. Our jurisdiction is much more on the state money. But my question really is that when we increase these rates, how much does the overall cost, not the funding side? I understand funding is one way, but when we increase provider rates, which I am supportive of, because I really feel they're not getting paid, right, or they could, we want to incentivize to get the right people to help our elderly. My question is, what is the cost? Is it, not on the funding side, but on the cost side? I saw it was 26 million a year, which felt very reasonable to me. But is it 100 million a year? Then I'm basically kind of thinking a different dynamic here that maybe, it's what is the number we are talking about?
It's 100 million a year, as Commissioner Gifford said, when the state starts funding it. And there is also, as they said, a decrease in other areas because keeping someone home costs less than some of the other areas that we pay for. So I just, I'm not trying to belay this, but I don't want to ask the same questions over and over again. Commissioner, can you succinctly answer that question that was asked and answered by Representative Walker or Representative Aurora?
Yeah, let me just say it back. So the annualized cost of the rate increases, so both the 6% and the 3.5% year over year for this irregardless of funding source, the annualized cost for the provider rate increases under these two authorities that we are considering today would be approximately 100 million per year total computable. Is that the right number, Mike?
So these particular authorities, right, are related to the waiver services only. So that number technically should not include the home health increase. So the 100 million, I think, was inclusive of home health. Right. So this 75. Would be closer to 70 or 75. But I do think it's important to note, which I think,
succinctly, Mike, succinctly.
Yeah.
Succinctly, please. We've been on for an hour and 15 minutes. Succinctly, please.
Some of this funding was included. Some of what's covered under these authorities is pure ARPA, and some of it was included in the base budget. So that rate increase is a mix. The ongoing ARPA only, the increase that we are adding because of the ARPA piece is approximately 25 million state share on an ongoing basis into the future. But that is only for the ARPA layer, if you would, that is included in the ARPA plan. But obviously the other piece is funded in the base legislative budget already.
Madam Chair, Madam Chair, there is something really not adding up here at all. I have a very bad feeling here, because if 100 million were the cost and the increase is 5%, that would mean that the home care program is $2 billion. I doubt that of the $6 billion or $7 billion of our spend, that $2 billion is in home care program. So 100 million it does not pass the smell test to me.
So Representative Aurora, I really think that you're missing the whole conversation, and I'm not trying to be obtuse here. And that's why I asked Mike to be succinct on this, because now everybody is talking about all different numbers. Every single person here is talking about all different numbers. You are talking one set. They're trying to give you a comprehensive number. That's what Representative Walker had. And so we have, the tutorial on the budget. You're on Human Services, and so I don't think that you get the opportunity to hear the appropriations side of this. And so I just want to step back from where you are. This passes the straight face smell test, quite frankly. And what this is right here in front of us today, and I'm going to pull everybody back to right here today, we are looking at a rate increase on a temporary basis. That's what we're funding, and everybody can worry about the out years, and I think there's something that we should always talk about, which we do on appropriations all the time. That's why I strongly suggest that you look at the FAC report on the OFA website, because that goes into a lot of the out years and talks about some of these rate increases. So I'm not trying to be not understanding of your concerns, but I think your concerns are addressed. And Representative Walker got the exact numbers. So,
Madam Chair, I love you being obtuse, because money is something we got to be direct about. I appreciate that about the way you're doing it. But I do, Madam Chair, numbers are numbers. I point out that the numbers are 100 million spent on, it's a leave alone everything else. The clear question here is 100 million a year, 100 million on a as a 5% increase does not add up.
So Representative Aurora, I'll tell you what, I don't often do this. I'd be happy to sit down with you and Mike to go through the numbers sometime to explain this to you. And because I think that to go through all of this, we need to sit down and talk about it sort of more globally than what you are hearing in today's meeting. Today's meeting is about the temporary increases of dollars for home health care and community-based services across the board. There's a wrinkle relative to the adult services, psychiatric issues, and I think that that's something that is relevant for us to talk about for the future, but not for today's confines of this of these temporary increases. So I think all you have to do is ask Representative France for a time frame when we can all sit down and chat about this. And we would go through it. Okay.
Well, thank you, Madam Chair, for indulging me, and I appreciate the opportunity to ask these questions, and I particularly appreciate the opportunity to sit down and discuss these numbers further. I'll yield here. Thank you.
Okay, thank you very much. Representative Santiago.
Thank you, Madam Chair, especially for making that pretty short. Because I sit in the Human Services Committee and sometimes it's very lengthy. But I just have one quick question because I kind of understand what's going on. And I might have some other questions, but I'll do those some other time. But I don't know if in the presentation I heard anything, and I might have missed it, on how we're going to review and audit or maybe look at training and hiring, recruitment and retention for these agencies. And that would be one of my biggest concerns because as you know, and as we know, I mean, my mother does get home care and we have a more aging population in the state of Connecticut. It's getting older. We have more people that are being disabled. These are not great paying jobs to begin with. A lot of people are getting underpaid for all the work that they do out in the field. So I just don't know how it's going to be, these recruitment plans are going to work to make sure that we keep people in these jobs and that we give them an incentive to stay in these jobs because these are the healthcare workers of the future. And again, because of our aging population, and even though this is temporarily and eventually the legislature is going to have to look at how to sustain this in the future, and we're going to have to find the dollars either through revamping the Medicaid program or looking at other incentives or other funding that we can help these folks. But to me, the workforce is what's keeping our home care and our agencies going. So is there a plan that has to be submitted with this waiver from the agencies, or is that something that DSS already works with and already has, it's in the works in their files? Thank you, Madam Chair.
Representative, thank you for that question. Yes, there are specific parts of this funding that are earmarked towards recruitment and retention. As we mentioned, the 5% one-time stabilization fund will be a significant amount of dollars, although it's one time, but will go to the agencies for recruitment and retention of current and future staff. Part of the rate increases, as Mike described, are aimed at the minimum wage increase, so to address the wages that you talked about. And then I would also note in the overall ARPA plan, separate and apart from these two authorities that we're talking about today, the overall ARPA plan, which I would refer you to, has a number of enhancements in training and quality for our home care agencies. So yes, we have addressed that in our plan, and thank you for that question.
Okay, great. Thank you so much.
Thank you, Representative Santiago.
Thank you, Madam Chair.
Representative Abercrombie, followed by Representative Case for the second time.
Thank you, Madam Chair, for the opportunity for the second time. First, a quick comment and then a question for Dawn. So it has to be the will of this body, this legislative body, to make it a priority and make sure that these providers are being paid a living wage. We are hearing right now that there is such a shortage, and that's because they have the opportunity to go and work in other fields and make a decent living and have health care. And so we have to make this a priority for all of us. You know, we hear about the shortage of the supply chain. Well, I want people to think about this. We have a human supply chain shortage, and it's getting worse by the day. So we need to make this a priority to make sure that these providers are getting paid a decent amount. And that's what this SPA that we're going to be voting on is going to do. It's going to try and stabilize this really fragile system, because at the end of the day, if we don't have these providers, we don't have a system of care, folks. And that means that these individuals go into institutionalized care where the state picks up 100% of it through Medicaid and it costs us twice as much. But the bottom line is people have the right to retain the rest of their lives in their homes with services. We have promoted that at the state for many years, and we need to continue to make that a priority. So I apologize for being on. Well, I'm not going to apologize. I think this is really important, and we all have to agree on this. My question is for Dawn, and it's just for qualification. I mean, for clarification, sorry. On the 5% that you talked about, if a provider in 2020-21 merged with another provider, will they still get that 5% under that agency for both the services in 2021 and current?
Yes.
Thank you very much. Thank you, Madam Chair.
Just how Dawn answered all questions, I'm hoping that everybody else can answer the same way. Representative Case.
Thank you, Madam Chair. How you doing?
Good. How are you?
Good. I have a little extra time today, so I thought I'd ask some more questions. So we talked about it, and Representative Abercrombie said it. These are some really hard times and some workers out there that we've been working very hard to try to take care of and try to work. But the big question is, and I guess Harry tried to talk about it a little bit, sustainability. We have these federal dollars. We're moving forward. This is a great thing. We have a minimum wage. We're going to tap out at 15, and then it's categorized after $15 an hour. That's going to keep going up. We need to start looking and having a plan going for the future so Commissioner Gifford and her team can understand, along with all these agencies, that they have sustainability. We can have sustainability for the next 2 years with the federal dollars that are coming in, but where do we go from there? And that's the conversation, I think, in human services that we need to have. And then Kathy needs to bring that to appropriations so that we can find the dollars for that. But we are all here talking about the federal dollars to offset Connecticut's issues with healthcare. We have so many people that are staying at home, so many disabled people, IDD people that are getting services at home. That's going to keep growing. People aren't going to nursing homes. People aren't going to group homes. People are getting care at home. How do we sustain that? And I know Representative Santiago, Hilda said, this is temporary. But temporary doesn't work for me. We need to have some ability to prove to these agencies that they're going to have monies going forward. Would I like to have that conversation of an 869-page implementer? Yes, I would. I'd like to have a conversation of where those dollars are. Maybe I will in the future. But in order for us to do this, we have to be cognizant of where do we go after the federal dollars run out? Where do we go after minimum wage keeps going up because it's categorized after the $15 an hour? These are people that take care of our most vulnerable people. And I don't envy, Commissioner Gifford and her team, because her agency is going to keep growing and growing and growing because there's going to be more and more people to take care of. And the reason, and I'm going to put Representative Abercrombie on the hook here, is we join human services because we care about the people and we want the people to move forward. So with that, I will stop, but I want to make sure that we have a plan going forward after the federal dollars run out and we don't hit a cliff.
So when you come back on appropriations, you can see the plans that we have in front of us.
No, I am part of the legislature and I am here for the people.
I'm just telling you that we have a plan. That's why I'm saying that.
Right. And I get that.
Why I'm
here
saying
for the people today who are listening to this on the web or on CTN, because they have the right to hear the answers to these questions, because we have to move forward as a state of Connecticut. I respect everything you do on appropriations, and somehow, being down at the casino or at the museum, we've got to find some more money there so that we can come back and we can throw all this stuff in, and I know you can do it. So
I'm glad they want the two largest minority-owned businesses to pay for everything. Does anybody have any more questions? relative to the temporary spot in front of us, only the temporary spot in front of us. Representative McCarty, not a comment, just a question. Do you have a question, ma'am?
I do have a question. I apologize if it's not completely related, but could we get from the home care?
If it's only related, ma'am, please, only related to the temporary spot in front of us.
This is, Kathy, this is very quick, just if we could have an idea of how many agencies have gone out of business, so we can have a trajectory going forward to make those changes that we need to keep up with the reimbursement rate. I would appreciate that, and I think it does relate, but I'm favorable to the waivers today. Thank you.
Thank you. Commissioner, if you could get that for us, please. You don't need to comment. Representative Aurora, any questions? Questions only, sir, on the temporary spot today.
Questions only, Madam Chair. Per your command. So my question here is that if we are making the increase in reimbursement, there is some discussion of performance-based. Can you talk to what performance-based and whether we are going to be able to get more productivity, either by providing more capital tools or equipment, so that we can enhance our workforce? Because for me, that's the most important, getting more out of productivity out of all of us. So is there, Madam Commissioner, is there some discussion or plans that as we pay more, that we would basically perhaps, help or assist in increased productivity?
So Representative, I would say that we do have part of the 1% increase is related to performance. In the early years, that has two specific actions tied to it. One is training for the workforce on diversity, equity, and inclusion. That process has already begun. We think that's very important training for the individuals in this industry. So we've been working with the industry on that. The second piece is to enhance the electronic capabilities of these agencies. So we're asking them to connect to our statewide health information exchange. Again, that process has already begun so that we can begin to have this home care integrated into the healthcare system electronically, a little bit more systematically. Beyond that, we will be working with our partners at UConn to develop quality measures for the home care industry that will become part of our ongoing work with them. But those are the first two concrete steps we're taking.
Thank you, Madam Commissioner. Thank you, Madam Commissioner. That's very helpful. Now, so 1% of the 6% is related to performance. So, but that 1% is subject to the provider taking the training, or that is the cost of the training?
No, it's a payment if the providers do these additional steps that they don't earn it automatically. They have to do both the equity training and the connection to the health information exchange.
I appreciate that. That's really good thing. I appreciate that. Thank you, Madam Chair. And thank you, Madam Commissioner.
Thank you very much. Senator Lesser, followed by Senator Ciccarella.
Yes, thank you, Madam Chair, and thank you, Madam Commissioner. It's good to see you. Just a quick question. I've been listening intently, and I agree with the concern about increases in the cost of living, increases in wages on our services agencies, making sure that we are keeping them whole. And I just wanted to know if DSS is also looking at the impact on consumers and making sure. I know that other states are moving to raise income and asset limits, and I was wondering if that was also something that DSS was looking as a possible use for these ARPA funds.
Senator, not specifically related to these SPA and waiver amendments that we're talking about today. So there isn't anything in our ARPA, this ARPA 9817 plan that relates to changing income and eligibility requirements. It's based on enhancing the services.
Thank you, Commissioner. I would just sort of echo that, I would emphasize that going forward, I hope to work with you and the agency, making sure that we can also make sure that we're doing what we can to also provide a continuation in services for the clients themselves by looking at those income and asset limits. And we can do that in another forum. But I want to thank you for being here, and I want to thank the chair for the time.
Thank you. Thank you, Senator Lesser. Senator Ciccarella.
Thank you. Just a quick question, and I apologize if I did miss this. I was going back and forth between two Zooms. But as we all identified, it's imperative that we get these businesses that provide this very, very important and relevant service to our elderly population and special needs population. I know the federal money is a big part of this. Do we know when they could start to see some of this much needed money and increase? Is there any idea of when that's going to start to come?
So as I mentioned, these are public health emergency related authorities. We expect a fairly rapid turnaround, a matter of a couple of weeks by our federal partners, and then we will be able to implement the payment increases.
Excellent. Thank you so much.
Thank you. Representative Aurora, I think you're up for the fourth time today. Do you have another question? You're on mute, sir.
For the record, Madam Chair, it's the third time.
Okay.
And I appreciate your indulging, but it's $100 million or $200 million vote here, so I hope you'll give me a little slack.
It's 500 million over 3 years, sir. That's why we need to have a conversation. You're conflating the numbers again. I just really I don't want to leave the wrong impression with people. This is a $500 million SPA over 3 years. Some of this is built into the base budget already. So I think that we have to be careful how we say it. That's why I'm more than willing to sit down with you to talk about this, but I'm not going to have the numbers misconstrued out there. So what is your question on the temporary SPA? Not on the out years.
Madam Chair, please, I understand you look at this number a lot more. I need to be able to, I feel too much pressure in getting my question. These are relevant questions because if you look at
question, sir, so we can move on. Thank you.
Madam Commissioner had mentioned that only a part of it is what we're going to be today's vote is on, and which is primarily the three which were mentioned, which added up to 80 million a year. And now what I'm hearing you say is that we're voting on the technology part as well, which is another 75 million. And some other, which I see in the August 21st presentation, I don't see in the other letter, which adds up to 500 million. So I think for clarity, are we voting just on the rate increases, which are 80 million a year, as just clarified by Madam Commissioner and the agency management, or is it all the three buckets we are voting on? Because you just mentioned it's all 500 million earlier. I heard it was only a subset of it. So because then I have two more questions on the other subset, because the other subset is much more difficult to vote on than the provider rate increases, which are generally we are all supportive of, or at least I speak for myself, I'm supportive of.
Commissioner, do you have any idea what this question is relevant to today's?
Yeah, Representative.
Can you answer it shortly, please?
Yeah, I'll do my best. Representative, today before the committees is the amendments to the waivers and state plan pertaining to provider rate increases as described in my testimony. The remainder of the larger ARPA plan, the presentation that you were referencing earlier, that has already been considered by the legislature and conditionally approved by CMS. Today, we're only discussing the waiver and state plan amendment that has to do with the provider rate increases, the 75 to 80 million annualized amount that you referenced.
Thank you. Thank you, Commissioner.
Thank you, Madam Chair. So the question really, that was just, Madam Chair, your clarification, this is 500 million, whereas Madam Commissioner has put record clear that this is 75 million a year for 3 years. My real question is that typically when we have rate increases, in most agencies and businesses, we try to consume less of that quantity of that service, mostly by, for example, using technology. Now, have you considered that since now this home health care per hour is going to cost you most likely 10% more, and as the minimum wage increases much more, is there any discussion and thought process being put as normal businesses or agencies would always plan for, to consume less of it by using technology, 5% fewer hours?
So Representative Aurora, if you wouldn't mind, please. This is already, I think that you're missing the point, sir. I'm not trying to be, again, obtuse, but these are direct.
Madam, it's coming out like that.
Direct care services, which means people working with people. So the fact is that we're not going to have a machine that takes care of a trach, or a machine that helps somebody with Alzheimer's through the day, or a machine that changes someone's clothes if they've had an accident. These are people working with people who have specific issues. We're not going to put a machine onto that. That's not what we're doing here. And what this does, quite frankly, and just so, Sue, if I lose my connection because my battery's dying, if I lose it, I'm going to join by phone. So if I come back in, I'll join by phone. And Representative Walker, if I go zero, could you please take over the conversation? Thank you. The fact is that we will see less services used in other areas, like care within a hospital, or care within a group home, or care within a nursing home. This costs less. And so we are looking at, like all businesses do, like all the businesses that are within human services have done, they have done more with less, more with less, more with less. And I always go back to my favorite person at Reliance Health, who said, I did more with less, I did more with less, and I did more with less. Now I'm going to have to do less with less, because my workers are on Husky, my workers are on food stamps, and my workers receive heating assistance, all which comes from the state for payment. So this is a complicated issue. That's why I'm trying to explain to you that this is not just about this one spa. And that's why I'm willing to sit down with you, but you're going into arenas that are not with today's vote. So I'm going to call the question out of order, and I'm going to go to Representative Case. Representative Case, for the third time. Thank you, sir.
Thank you, Madam Chair. So I just want to try to bring it back a little bit to reality. And I agree with what you said, that, this is about today's vote, and it's about bringing the vote to the plan that the commissioner has put together. I think that the people need to understand, and you do too, and we are working with the most vulnerable people, and that's who we're trying to take care of here. I think there's been a lot of questions that have been asked, and maybe we can get those answered at a later date, but this is the place for the people to understand those questions. And bottom line is, we need these agencies and the workers in these agencies to make sure that they know what their future is, that this is sustainable. We have a 2-year plan, as the commissioner has put forward here, for a change in the plan to be voted on. The issue is, and it's a fair question, are we going to be able to sustain it? And are we being true to those workers, that these dollars are going to continue on, and that they're going to be able to understand that it's going to keep growing for them in the future? So I guess my bottom line is, Commissioner Gifford, are we going to be able to work on a plan to allow this, to make sure that we can go forward and keep these workers in the field that they're in, taking care of the most vulnerable people in our community? Because you and I have had many conversations regarding the most vulnerable, and I think we have an issue with everything that's going on right now. We're probably going to have some more people that are going to be taking care of home and in the home care, and I think we're going to have to look at more funding.
Yes, Representative, we look forward to working with you and the appropriations on the sustainability. And as I mentioned, we will be bringing the permanent authorities before these committees before the expiration of the public health emergency.
And I thank you for that, because I think the word temporary sometimes scares some people, because temporary just means that it exactly what it says, temporary. And those workers need to have a permanent solution.
Thank you, Representative Case. Representative Datham for the first time.
Thank you very much, Madam Chair, and thank you, Commissioner Gifford, for your presentation this morning. I have been working on a work group this fall that's dealing with hospice home care, and what I've learned during this process is this is growing so much, and we need to make sure that we are there to work with our communities and make sure that the services are there for people to have decisions about where they choose their final moments or where they choose to have their care. So I'm very supportive of the work that you're doing. I am pleased to hear that there is continuing discussion to make these permanent. I know things change so quickly in our state. I mean, we look at 2 years ago today, we didn't know what an impact COVID was going to have on our lives and everything. And so I think we have a wonderful opportunity here to make sure that the lives are better for the people who make the decisions to stay at home, and they have the choices because they have the services and the dedicated.
So Lucy, I'm wondering, do you have a question, ma'am?
I just wanted to say that's why I popped in at the end. Thank you very much, but thank you for working on this, and we continue to look forward to hearing the conversation.
Thank you very much. Now the public hearing will come to an end. We appreciate all the questions and the time spent on this issue, Commissioner, and the other public speakers. Thank you very much. Madam Administrator, the public hearing is ended. And Madam Administrator, we will start the committee meeting.
That's correct, Madam Chair. The Human Services Committee will vote first.
Thank you very much, Madam Administrator. Are you ready, ma'am?
Excuse me.
Yeah. Representative Case, did you say something?
Are we going to have a meeting? Do we have time for questions as a committee?
No, we're going right into the meeting. That would be something that, so
if we go into a meeting, we're having a meeting, so we're going to ask each other questions, correct?
Oh, just wait 1 minute, Representative Case. We have to be back on the record, and we're not on the record right now, sir.
I would like to call to order the meeting.
Wait, Mayor Marilyn, you can't yet.
No.
We're not being recorded yet.
Madam Chair?
Yes.
We don't need to be concerned about recording on Zoom the committee meetings because they are being broadcast on YouTube Live and on CTN. So we're covered. So you needn't worry about Zoom being reactivated.
Okay, so I'm going to call the Appropriations Committee meeting to order and turn it over to Senator Moore for the Human Services Committee.
Thank you, Madam Chair. Calling to order the Human Service meeting we're voting on, this will be a vote on the ARPA HCBS applications.
So moved, Representative.
Second by Santiago.
I'm sorry, who second?
Go ahead, Hilda.
Second by Representative Santiago.
Thank you. We'll be taking a roll call vote.
Senator Moore, I don't know if you have to request discussion of the motion before we take the vote.
Thank you. Is there a discussion? Any questions, comments? I see none. Do you see any, Heather?
Yes, I see Representative Case has his hand up.
Representative Case.
Thank you, Senator Moore. I'm hoping you'd be able to answer this. So in final, we are doing a temporary ARPA plan of amendment. Is that correct? And what is the final dollar amount? And is it just a 2-year plan of amendment through you?
Who can answer that question for the final dollar amount, please?
Madam Chair, even though it's an unusual situation that we don't usually do this, if DSS staff, which I see they still are, they are on the call. If you would like, you may ask DSS to respond.
Thank you. Commissioner Gifford, can you help with that question, please? Is anyone
Senator.
on still that from Commissioner Gifford's office, excuse me, that could help with that? Mike, are you still here?
Yes, I am, Senator, but I do have to apologize. I caught the tail end of the question, but did not hear the full question. I'm sorry, Representative Case.
That's okay, Michael. I think we're getting ready to vote, and I wanted to make sure that we're all understanding that this is a 2-year plan of amendment, and that it is temporary funds. And I was just looking for a clarification for the record of the amount of dollars that we are voting on today, and that it is not a permanent, it is a temporary plan of amendment.
So I will take on maybe the dollar piece first, because I believe that's easier. So, the amount of the increase, the estimated amount of what we're voting on here in terms of rate increases and the 5% temporary payment is approximately $75 million. That is the amount that's associated with these waiver submissions. I do want to emphasize, though, that the waiver authorities that we're seeking to utilize, will be renewed before the end of the expiration in the same format and structure, so that these rate increases can continue, and the budgeting that will be included in the upcoming recommended adjustments to the biennial budget will include the funding necessary to continue these. So there certainly is an expectation and a commitment to continuing these rate increases, even though this is a temporary authority.
Michael, and I thank you for your answer. And I'm hoping that we were still in the area where we can ask you a lot of questions, because now I just hear you say 75 million. I've heard 250 million, and I've heard 500 million. We're taking a vote right now. And yes, I want to help all those most vulnerable people and the people that we're taking care of. Which is it? 75 million, 500 million, or 250 million?
The vote for today is associated with the 75 million, which is a subset of the broader ARPA plan, which is the 500 million over a 3-year period. But the particular documents before you today are associated with the 75 million.
So today is 75 million, and then we will come back for others.
To the extent that we need waiver authorities for those other activities, yes.
Thank you, Michael, for your answers.
Representative Case, does that answer your question?
Yes, ma'am.
Thank you. You're welcome. Are there any other questions?
Rep. Aurora has his hand up.
Representative Aurora, good morning.
Good morning. Thank you, Madam Chair. I have one very quick question that when this were to be extended, perhaps Commissioner or Deputy Commissioner Gilbert could answer this, is if this were to be extended 80 million a year, would there be a FMAP kind of match so that the cost to us would be still half of it, 50% of it, or not the whole 80 million? Just kind of, I'm thinking ahead, perhaps, as to because sustainability is extremely important. And I would love to hear if that FMAP is still going to continue, make it that we still have to pay half of it or a portion of it.
Madam Chair.
Yes, Representative, we receive FMAP on all of our Medicaid expenditures.
Okay, great. Thank you. So really, from a sustainability, I think it does might comfort some of our members that it might be only a 40 million a year or even less if the FMAP is higher because, of some of the other demographics, at least 50% FMAP, so that the longer term impact to the budget would be, could talk about 40 or 30 million a year. Thank you, Madam Chair, and thank you for that clarification.
Madam Chair, point of order.
Senator Lesser.
Yes, thank you, Madam Chair. We just had a public hearing on the same subject matter, and while I understand the chair granting some leeway to get some clarity on some questions, I just want to make sure that we don't have a second public hearing during this committee meeting, since that's not the ordinary order. So I don't know if that's the correct point, but just want to make sure that we can debate the information we just received rather than having a second set of public hearings. Thank you, Madam Chair.
Thank you, Senator Lesser, and I want you to get out of my head. I was thinking the same thing. If there are no other questions.
Senator Berthel has his hand raised, Madam Chair.
Senator Berthel.
Madam Chair, thank you, and always good to see you here, even though it's virtual. Keeping in mind just what Senator Lesser has brought out, I think that it is also important in the context of the meeting itself to make sure that we, as a committee, are understanding what we have just acquired as knowledge in a public hearing. So I do want to ask a clarifying question. Perhaps the commissioner or deputy commissioner can just provide us again with the actual understanding of a very important point that is probably, to me at least, is one of the most important right now and most vulnerable. And that is when these retro payments will go into effect. I think I heard July for one of them and August for the other, but that there is a time period where we have to wait for some other level of approval. Representative Abercrombie, you're shaking your head. Is that, did I have that wrong? Or I just want to make sure this is something we can affect immediately, and to make sure that we're getting the assistance that these providers have been pleading with us to provide them. So I just want to make sure for the record for our committee that we are all on exactly the same page with respect to implementation and expectations for those retro payments going back to these providers. Thank you, Madam Chair.
Through you, Madam Chair, may I respond?
Representative Abercrombie.
Thank you, Senator, for that question. There were two answers that were given. The August answer is when we received, through a hearing, the plan using those dollars. The retro is July 1st. Thank you, Madam Chair.
Okay, thank you. And I appreciate the clarification, Representative. Thank you very much.
Thank you, Senator Berthel, and thank you, Representative Abercrombie. Are there any other questions? Heather, do you see anyone else's hand up?
I do not, Senator Moore.
Thank you. If there are no more questions, we'll do a roll call vote.
Thank you, Senator. This is to approve the applications for amendments to Appendix K Disaster Relief Section 1915C waivers and Medicaid State Plan 22-0003 Disaster Relief SPA. Representative Abercrombie.
Abercrombie, yes.
Senator Moore.
Moore, yes.
I'm sorry, Senator, could you repeat that, please?
Moore, yes.
Thank you. Senator Berthel.
Senator Berthel votes in the affirmative.
Representative Case.
Representative Case is a yes.
Senator Lesser.
Senator Lesser is a yes.
Sorry, Senator, could you repeat that, please?
I can. Senator Lesser is a yes.
Thank you. Representative Leeper.
Leeper is a yes.
Representative, could you repeat that, please?
Leeper is a yes.
Thank you. Senator Cabrera. Representative Butler. Representative Cook.
Representative Cook is a yes.
Representative Dathan.
Representative Dathan is a yes.
Representative Garibay.
Garibay votes yes.
Representative Goupil.
Representative Goupil is yes.
Representative Hughes.
Representative Hughes is a yes.
Representative Santiago.
Representative Santiago is a yes.
Representative Stallworth.
Representative Stallworth is a yes.
Representative Aurora.
Aurora is a yes.
Representative Buckby. Representative Master, oh, sorry, Representative Buckby, are you here? No. Representative Master Francesco. Representative Scott.
Representative Scott votes yes.
Representative Wood. Are there any other members of the Human Services Committee who have not voted who wish to do so?
Oh, Heather, I saw that my was on mute. Do you need me to repeat the vote?
I did not hear you. So Representative Wood, how do you vote?
Representative Wood votes yes. Thank you.
Thank you, Representative.
When you're ready, Heather, would you give us the tally?
Thank you, Madam Chair. Total number voting 16, total voting yay 16, total voting nay 0, total abstaining 0, total number absent not voting 4. Thank you, Madam Chair.
Thank you. So I believe I'm to recess this portion of the meeting and hand it over to appropriations.
Thank you very much, Senator Moore. So I'll entertain a motion.
I make a motion to approve the applications for amendments to Appendix K disaster relief fund, disaster relief section 1915C waivers and Medicaid state plan 22-0003 disaster relief spa.
Second by Nolan. Seconds.
Okay, it's been moved by Representative Walker, seconded by Representative Belinsky. Are there any questions or discussion? Seeing none, Madam Administrator, if you could call the roll, please.
Senator Austin.
Senator Austin votes in the affirmative.
Representative Walker.
Representative Walker votes in the affirmative.
Senator Hartley.
Senator Hartley in the affirmative.
Representative Dathan.
Representative Dathan is a yes.
Representative Nolan.
Representative Nolan is a yes.
Senator Minor. Representative France.
Representative France votes yes.
Representative Abercrombie.
Representative Abercrombie votes yes.
Senator Doherty Abrams. Senator Anwar. Representative Baker.
Representative Baker votes yes.
Representative Betts. Representative Belinsky.
Representative Belinsky votes yay. Got to be different.
Representative Candelaria.
Candelaria votes yes.
Senator Ciccarella.
Okay.
George, I have
Senator
Ciccarella.
Senator
Ciccarella votes
Okay,
yes.
Paul.
Nice speaking.
Thank you.
Representative Curry.
Representative Curry votes in the affirmative.
Representative Dillon. Representative Felipe.
Representative Felipe votes yes.
Representative Ferraro.
Representative Ferraro votes yes.
Senator Flexer.
Senator Flexer votes yes.
Ma'am, if you
Senator
could-
Flexer votes yes.
Great, thank you. Representative Gibson.
Representative Gibson votes yes.
Representative Gilchrist.
Representative Gilchrist votes yes.
Representative Gonzalez. Representative Haddad. Representative Carol Hall. Representative Joshua Hall. Representative Harrison.
Representative Harrison votes yes.
Representative Hayes. Representative Howard. Representative Johnson.
Representative Johnson votes yes.
Representative Kennedy. Senator Kushner.
Yes.
Oh, sorry. Thank you. Representative Kennedy. I see you now. Thank
Okay.
you.
Kennedy votes yes.
Thank you. Senator
Thank you.
Kushner.
Senator Kushner votes yes.
Senator Lesser.
Senator Lesser in the affirmative.
Senator Lopes.
Senator Lopes votes yes.
Representative McCarty.
Representative McCarty votes yes.
Senator McCrory.
Senator McCrory votes yes, Susan.
Thank you, sir. Representative Pavlak D'Amato. Representative Porter.
Representative Porter votes in the affirmative.
Representative Reyes.
Representative Reyes votes in the affirmative.
Representative Rosario.
Representative Rosario in the affirmative.
Representative Ryan.
Representative Ryan votes yes.
Ooh, great.
Representative,
Thank you. Yep,
you got me? You got me? Okay.
gotcha. Thank you. Representative Sanchez. Representative Sims. Senator Summers. Representative Tersiak. Representative Turco.
Representative Turco votes yes.
Representative Wilson.
Representative Wilson votes yes.
Senator Winfield.
Senator Winfield in the affirmative.
Representative Zawistowski.
Representative Zawistowski votes yes.
Thank you. Are there any members of the Appropriations Committee who have not yet voted who would like to do so?
Yes.
Thank you, Representative Haddad.
Yes.
Gotcha. Anyone else?
Madam Administrator,
Yes,
I
sir.
just wanted to confirm that you received my vote when it was cast.
Yes, sir. I have your vote.
Thank you very much, Madam Administrator.
You're welcome. Ready when you are, Madam Chair.
I don't.
Oh, no, I was on mute. I apologize. Madam Administrator, do you have the tally?
I do. Total number voting 34, those voting yea 34, those voting nay 0, those abstaining 0, those absent not voting 15.
Thank you very much, Madam Administrator. The motion passes. Madam Administrator, what do we have up next on our agendas?
Nothing so far, but stay tuned. We're just a matter of weeks away from starting our budget hearings, which will begin the week after the start of the session. So around February 16th. Stay tuned for the schedule.
So just tell everybody not to plan on Valentine's Day. Is that what we're doing, Madam Administrator? So
Yeah.
okay, I'll entertain a motion to adjourn.
So moved.
It's moved by
Second.
Representative Walker, seconded by
I'll second it.
Representative
Kathleen,
McCarty.
Representative McCarty. Thank you. All those in favor of adjourning indicate by saying aye.
Aye.
Any opposed? Any abstentions? Motion carries. I hope you all have a nice day. Talk to you soon. And Representative Walker, I'll be giving you a call in a couple minutes. Thank you. Senator Moore, it's now over to you.
Thank you. I'm going to ask for a motion to adjourn the meeting.
So moved.
Moved and seconded. I'm sorry, I didn't hear the second.
Second, Representative Dathan.
Thank you. No objections, we'll adjourn the meeting. Representative Abercrombie, did you want to say something?
No, have a good day, everybody. Thank you.
All right, thank you all. The meeting's adjourned.